Ever since I was a little girl, I wanted to be a nurse. Care and compassion and empathy, I think, is one of the fundamental qualities that a nurse should have. I think there's a bit of a misconception with regards to working in the independent sector from an educational point of view as well, and development. There are lots of great opportunities that the independent sector can offer.
I chose a career in nursing really just because I thought I could help people to get better, improve their health, and I am a people person. I thought this would be an ideal career for me to have.
When I first started at this hospital, I was offered acute oncology. I then did my level 7 mentorship, which means that I therefore take students when they come to the hospital and mentor them through their program.
It was very overwhelming at the beginning, but later on when I gained confidence in doing small procedures, I eventually built up into bigger ones. My mentor was very supportive and gave me confidence to do more.
As a junior staff nurse, you work with a member of staff who is classed as your mentor or preceptor. It was a fantastic experience. I really enjoyed it, especially the intensive care side of things.
You have a mentorship. You are called his or her shadow. How they deliver the medication, what kind of care they taking here, what kind of paperwork. And it's very interesting because it's helping a lot to get used to what kind of treatment they carry out.
My manager is my mentor. We work well together. She provides me with a lot of support, and I feel that we have a relationship where I can go and ask her about anything.
One of the requirements by the Nursing and Midwifery Council is to continue with your personal professional development. Majority of the funding for my courses over the years came from the educational budget from the hospital.
You're always working with very qualified team, and if you want to do anything, they make sure that you are qualified to do it. If not, they give you the chance to go to university and to take those courses.
They encouraged me to take on different roles, hence why I managed the ward for 6 months last year, and they're interested in putting me through the King's Fund matron programme next year.
We kind of called it matron school, if you like. It was a year-long course facilitated by the King's Fund, and it was all about leadership development.
I feel that the hospital will be very supportive with my goals in this career pathway because they've supported me since I've started.
They do care about the staff, and the staff are as important as the patients.
Within my development, I think I'll stay within the organisation because it's been very good and I've learned a lot and I've had lots of opportunities. The organisation's been really good to support me personally through anything that I've wanted to do, and I've got absolutely no doubt that I'll be supported.
Not one day is the same, not one patient is the same, not one nurse is the same. So you need to be able to mould into that team.
I think you must be enthusiastic, hardworking, and you must love what you're doing in order for you to fit into the independent sector.
I think communication plays a massive role. I always tell my boss that I'm a great communicator.
We're all very friendly, very sociable, we get on extremely well together. Teamwork is something that is completely emphasised through the whole unit.
If you have those lines of communication, then it's taking away a risk of anything being missed or patients feeling like their needs aren't met.
It's very nice to go to work every day knowing that there could be something new that you learn, there could be new people that you meet. Nursing always felt like an adventure rather than a job.
My advice for the people that are thinking to start working as a nurse in the independent sector is just to come and see. If you like to help people and you like to spend time with people and give the best care possible, this is the best place to be.
Getting to know the patients and building a rapport with them really made me feel like I was making a difference and helping.
It's not a glamorous career, but it's extremely rewarding. It's different every single day.